Hello, everyone. This is Chris Frederick with the Collaborative Care Collective, and I'm excited to be here with Dr. Xiao Yuan. Welcome.
Hi, everybody.
We're going to get started because we want to talk about, we have a summit coming up next month in June. I'm very excited. You were there last year at our first summit on the low back pain and pelvis pain. And so this year, it's going to be the upper quadrant, cervical thoracic, scapulothoracic. And I want to start just by having you introduce yourself. If you can tell us a bit about your profession, your experience, and maybe any special interests you have in research or non-research.
hmm so I'm a family physician by training, and pretty much right out of residency, I started learning about trigger point injections. And so I've had a special interest in doing interventional treatments to treat chronic musculoskeletal pain. And since I started about coming up on 8 years ago, I've now dived into the world of regenerative therapy, doing injections to help release nerves that might be trapped. And in the past 2 years, also a lot more about fascia treatments. And so that's where my interest has been quite a bit over the past 2 years. I took a workshop with Dr. Bradley Fullerton a couple years ago, and I think Chris, you were part of that as well.
Mhm.
And that was like so enlightening, and I've been practicing a lot based on that framework. I still do some family practice, so I do 2 days a week in family medicine, 3 days a week in pain medicine, and that keeps my brain going.
You have a big smile on your face when you describe all this. It sounds like you're happy practicing as you do now.
Yeah, I really enjoy my practice the way it is right now. It's nice and balanced, and it's quite satisfying.
Yeah, great. Why did you attend last year's, I'll call it C3, Collaborative Care Collective. We shorten it to C3. It's just a little easier to say and you don't trip over your tongue, right? But I was curious why you attended it last year. What was your motivation? Did someone recommend? Did you just see it and it attracted, you? And what did it do for you, if anything?
That's a great question. I heard about the conference from Dr. Fullerton because I
Uh,
had done his online workshop. And I looked at the schedule and I was like, wow, I can learn so much more about the lower back and SI joint area. And one of my big motivations for going was to actually meet Dr. Fullerton in person and to meet Dr. Philip Steele and all these innovators who are in the field who are doing all these cool, interesting things. Because I find like doing the workshop and learning kind of through a course is one thing, but being at a conference and being able to pick their brains and hear about what they're working on that's new, that was really exciting to me. So meeting them was one of my big motivators for going.
right.
And it totally panned out. Like I got to chat with them. Dr. Steele told me about some of his videos that I weren't aware of before. And going to that conference has really been a transformational part of my practice.
Excellent. Really happy to hear that it worked out that way. So I've heard you've been working with my mentor and renowned physiotherapist. They say physiotherapist in Canada and outside America, and we say physical therapist here. Can be confusing, same thing, with Diane Lee. So I was curious, can you share anything about that that you're allowed to speak about? I don't know. I don't want to be a spoiler here with anything she's going to present, but it's okay to tantalize us with anything. So anyway, whatever you're working on,
Hmm.
so feel free.
Um, well, it's been just a pleasure working and collaborating with Diane because I only know so much from my physician point of view. And to work with her, like she can feel all of these rib rotations or cervical rotations that I currently have no way to to figure out. But in working in tandem with her, like we would spend about an hour, both of us in the same room with a complex patient, and we've discovered some really interesting things. So if for those of you who know about like that fascia approach with Dr. Fullerton, we know that if a person has like a fascia tear or a looseness somewhere, and you sometimes all it takes is you press one finger on the spot where have that fascia tear, and then you test their arm strength or their leg strength, and it immediately goes from being weak to being strong. So we know about that phenomenon and we can treat that using injections. But what was really cool in working with Diane is we were able to assess biomechanically what's actually happening in the body when we press on these fascia tears and when we treat them. So, for example, we found that fascia tears in the back of the neck can actually cause your vertebrae to rotate. And when
Hmm.
you fix some of these, the vertebrae rotation automatically improves.
Hmm.
So I think that's probably something that people haven't really had a chance to look into yet, and we're making some kind of actually new discoveries. So at the conference, I'll actually be co-presenting her about one of our complex patients where we learned all these things.
Mm.
So participants for this year's conference will be able to hear about some of the very interesting and surprising biomechanical changes that we found.
How exciting. Well, in my discussions with the physicians that are part of the planning committee and also have presented, I've learned how much they have learned from physical therapists like Diane Lee and others who are going to be there. And a little bit for me too, because I did my presentation last year too, and I do my own little finger test that I didn't even know Brad was doing this when I was doing it also. And so it's kind of cool to collaborate and come together on this. But what I wanted to say was it's changing physical examination. It's changing, how you can get immediate changes in their subjective pain and function. If you do a temporary correction, let's call it, or let's say we call it adding integrity to the fascia, right? It's called fascia integrity or tensegrity, tension integrity. When we add tension where there is lacking from a tear, and you add it with your fingers in the appropriate place, which we'll talk about at the conference for those of you listening, and we'll teach you also what we're doing with this to come up with faster diagnosis and faster treatment. This didn't exist so much before with physicians. They didn't learn this at all. And it took pioneers like Brad Fullerton and the rest of the group to put their heads together and get together with themselves. But then later, they got together with people like Diane Lee and Gail Wetzler and Dawn Saldaducci, however you say her name, and others, Nancy and others who are amazing physiotherapists to work collaborative to get even better findings as well as results.
Absolutely. I've, through implementing these fascia directed techniques over the past 2 years, um, I've been able to help so many more patients. I even had patients where I was treating before using trigger point injections or nerve blocks, and they just weren't getting better. And then I
Mm.
started applying the fascia approach to these patients, and so many more patients are getting better. So it really takes all these innovators from the different fields to all come together with their different knowledge and stimulate new ideas. And
Hmm.
I think the C3 conference is the culmination of that. And I'm very excited to attend this year's conference because I just can't wait to see what these other physicians and physiotherapists are finding out.
Yeah, I think it will help physicians, and I'd really like to hear you weigh in on this. It will help physicians, I believe, and physical therapists and other allied health with still being able to do things that we can help speed up the process in diagnosis and treatment, even if you're still in the medical system with a health care insurance reimbursement model. However, a number of speakers, I think all of them, if not all of them, most of them are working outside of the insurance reimbursement system, which means they have more control over not treating just the diagnosis, but treating related kinetic chain. We call it upstream downstream effects, as you're learning, that they would normally pay for. You'd have to lobby or appeal, make requests for this. And so these physicians, we can learn. I think other physicians and physical therapists can learn from those who are working outside the traditional system by actually taking more time with the client, with the patient, with their initial intake, constant questioning, retesting, reevaluating. They have the luxury of the little extra time, and to do extra tests, because most of the patients are paying out of their own pocket because nothing has helped them. And so there's a demand for this kind of physician and physiotherapists. And I just like you to maybe, if you have any words about that, we have a mixture of attendees. Most are in the system, I would say, and they kind of want to learn, how can I get out, maybe out of the system, possibly, or maybe I have a hybrid of both, right? You have the client patients willing to come in and cash pay, and then you have the insurance-based ones. Well, do you have anything to say about that?
Mm, I guess that's a really complex question.
Okay.
Me being in Canada, that's a bit
Right.
applicable as well.
Yeah.
But basically, what I have been able to do is for some patients, they do pay for longer appointments with me now instead of the regular like 15-minute follow-up, you're in, you're out, that sort of thing. And I've had patients, because they're coming in for longer sessions, I am able to do these more comprehensive assessments
Hmm.
and lead to faster results.
Yes.
And patients who have had pain for 15, 20 years are now suddenly improving and seeing at least a 50 to 70% reduction in their pain over the span of 4 or 5 months. And so it's just so satisfying to be able to treat patients this way, because patients feel like they're getting above and beyond service. And I feel great too, because my patients are getting better. So it's satisfying. And some of these assessment approaches, like we alluded to earlier, all you need to do is put one finger on one spot, and
Hmm.
patients can feel the difference in their own strength. And after you do the injections, the strength is improved right away. And so it instills a lot of hope for the patients as well. And it also proves to them that the
Hmm.
treatment is going to work, and you get a lot of buy-in from your patients.
Yeah, and most of the physicians are using ultrasound imaging to substantiate where they put their finger, and they could actually verify that with evidence of the ultrasound. Yeah, this is torn. I thought it was. It felt like it was. It responded with increased strength after I supported it with my fingers. But let's see if the ultrasound shows evidence of it. I would say it does, just because once you get good at this physical examination process, this diagnostic process, the two work faster and faster. You get better and better at this, I think, as a physician and as a physical therapist using your manual therapy techniques. And the patients get better quicker. It takes a little time to learn this. It's like any skill, like any surgeon who learns surgery, or anyone who learns even how to sew, incisions. It takes time to learn the skills, and then you learn it and you can do it,
Yeah.
you can implement it. I would say, in ending this conversation, which I could talk about it forever, but we don't have forever. Where can other physicians like you, and physical therapists send their? Well, actually, I wanted to say, what if you had to speak to a physician like you, family medicine, or any physician who is curious about the C3, the Collaborative Care Collective, and the experience, and what they're going to get out of it? Any final words summarizing it? You kind of said it, but what would you summarize to someone at the end of this conversation? what words of advice would you have for them regarding this conference? Is it worth going to the summit?
That's a tall order. Absolutely, it is so worth it to go. Going last year just really opened my world to the different types of treatment modalities that are available out there, other than treatments with physicians. And even as a physician myself, I found that the methods of like figuring out where the fascia is torn is really not that difficult to learn. Like with some of the physiotherapy techniques, you have to be able to feel which direction is rib is rotated, or is that hip joint sitting anterior in the socket. But with the fascia approach that we use and apply as physicians, it's actually really straightforward.
Mhm.
And I found it quite easy to learn. In fact, when you and I attended the virtual workshop with Brad when it first happened a couple of years ago, and I learned all of the skills virtually. So I would say if you're a physician and you're having patients who are not getting better, and you're tired of having to tell patients, this is all I can do for you, coming to the C3 conference is going to light up your world and give you a whole new set of treatment modalities that can make those patients a lot better. And for the physiotherapists as well, I think there's so much disconnectedness between the physiotherapist world and the physician world. Like, even
Mhm.
though we recommend patients to each other all the time, we don't really know like what is it that the
Mhm.
physiotherapists are doing. And so to be able to understand all the things that they can feel just with their hands, it was really mind blowing. And so, so for the physio, as a physician, that was super enlightening. And if you're a physiotherapist, absolutely, it's worth going as well, because then you also hear about what the physicians can do. And
Mhm.
yeah, yeah, totally worth it.
Well, wonderful. Thank you so much for that. That was inspiring. If I wasn't going and myself and presenting, I would go just based on that. Finally, where can other physicians and patients refer to you if you're still open to new patients coming, either cash pay or insurance, however it works in Canada? Um, where can they reach you? Is there a website? Like, where do they get that connection? Feel free to right now tell them where to go.
So I work at White Oak Pain Clinic in just outside of Vancouver, British Columbia in Canada. Our website is whiteoakpain.ca, and you can find all of our information on there. Our wait list is about 4 months right now, so we do
Wow.
require a physician's referral for if you have insurance in Canada. But yeah, I'd be happy to share more information and knowledge and see new patients, or even chat with other physicians about my experience. So feel free to reach out.
Great. Well, for those listening, you just heard from Dr. Xiao Yuan. And we encourage you, we invite you to come to the next Collaborative Care Collective meeting or summit for 3 days starting June 27th through June 29th in Denver, Colorado, USA. We hope to see you there. Thank you so much for your time today and your inspiration.
Thanks, everybody. Bye.